Okay, let's unpack this. What if everything you've been told about blood pressure and aging is, well, fundamentally wrong? We've all heard it right. Rising blood pressure, it's just an inevitable part of getting older, something you just manage with pills. But what if there's a powerful natural path to healthy numbers? Maybe one that comes straight from, say, your garden. Today, we're diving into some really extraordinary insights from Dr. Lisa, a Vietnamese traditional medicine practitioner. She's apparently seen patients, some as old as 89, reduce their blood pressure by a remarkable 40 points. And she's using specific herbs. These aren't just random remedies, They're time-tested, scientifically validated traditions, and they seem to be specifically tailored for seniors.
Yeah, and what's truly fascinating here is how this perspective really shifts things. It moves away from just managing symptoms, chasing numbers, towards understanding the body's deeper intelligence. So many people feel kind of trapped by conventional wisdom, thinking medication is their only real option. This deep dive into traditional Vietnamese medicine, or VTM as we'll call it, it reveals a more holistic approach that I think we've largely overlooked in the West.
Exactly. And that brings us to what Dr. Lisa calls the hidden crisis in conventional blood pressure management. I mean, get this. Over 65% of seniors on medications still struggle with uncontrolled hypertension. That's a staggering number. And it's not just about failing to control the numbers. These medications often come with a whole laundry list of pretty debilitating side effects. Things like dizziness, fatigue, kidney issues, even an increased risk of falls, which is huge for seniors. It feels like this cycle where mainstream medicine often treats the symptoms, but like you said, according to traditional medicine, it completely misses the root of the tree.
It really does. And if we connect this to the bigger picture, VTM offers a profoundly different way of understanding high blood pressure in older adults. It's not simply about arteries getting old and stiff. That's part of it, maybe, but not the whole picture. VTM principles suggest high blood pressure often stems from three core underlying imbalances. First, there's something called kidney essence weakness. You can sort of imagine your body's deep vital energy, its battery, starting to run low. This affects everything, hormones, overall resilience.
Okay, kidney essence, got it.
Then there's liver stagnation. Now, this isn't just about your physical liver organ. It's more about how your body processes stress and emotions.
Right.
When that gets stuck, it creates this internal pressure.
Wow, the stress connection.
Right, exactly. And finally, there's blood stasis, which is basically just sluggish circulation. Think of it like traffic jams in your blood vessels, preventing vital nutrients and energy from flowing freely. These aren't just abstract ideas, they're seen as fundamental to how your body functions. And unlike pharmaceuticals that often, force a specific response from your cardiovascular system.
Right, like forcing the numbers down.
Precisely. Herbs work differently. They aim to restore these underlying imbalances by providing natural compounds. They work with your body's innate intelligence rather than sort of overriding it.
That makes sense. Working with the body.
And this isn't just ancient folklore either. The Journal of Traditional Medicine actually reviewed specific herbal combinations. They found these combos could reduce systolic blood pressure by maybe 15 to 20 points. But here's the key part. While also improving overall cardiovascular health, not just masking the symptoms.
Wow, improving health, not just the number.
Exactly. And the herbs we'll discuss today, they meet three really important criteria. One, they're scientifically validated to some extent. Two, they're generally considered safe for older adults. And three, they have known profiles regarding compatibility with common medications, though caution is always needed. So this alternative perspective, it offers a pathway to not just lower numbers, but maybe to address the fundamental imbalances causing the issue in the first place.
That's a powerful shift in thinking.
Yeah.
Moving from just symptoms to truly supporting the body's natural healing ability. So what does this all mean for your journey towards balanced blood pressure? How do these ideas become practical?
Yeah.
Let's dive into 5 specific Vietnamese herbal powerhouses. These seem to form the core of Dr. Lisa's protocol. These are natural tools, right? With both a rich history of use and some strong modern scientific backing.
Absolutely. Let's start with Dan Shen, or Salvia militariza. It's often called the heart protector. In VTM, it's really revered for moving blood and also calming the spirit. Or Shen, how it works. Well, it contains compounds, salvinolic acids, that act like a gentle relaxant for your blood vessel walls. Makes them more flexible, improves circulation.
Okay, relaxing the vessels.
Yep. And there was a 2019 study, I think in cardiovascular research, that showed Danshen reduced systolic blood pressure by an average of 12 points in patients over 65. And that was within 8 weeks. What's really interesting for seniors is its ability to regulate. It seems to lower high blood pressure, but also helps stabilize normal readings, so it might help avoid those sudden drops, like orthostatic hypotension when you stand up too fast.
That's a huge benefit.
It is. Typically, the usage is around 500 milligrams of a standardized extract, twice daily with meals. But you definitely want to start slowly and monitor. Next up, we have Gou Teng. That's Uncaria rhynchophila, also known as the gentle regulator. This herb's really crucial for managing that stress response component we talked about, the one that drives blood pressure spikes. VTM calls this calming liver yang rising, basically chilling out internal pressure.
Tackling the stress part again?
Exactly. It contains alkaloids like rhinchophine that act a bit like natural calcium channel blockers, but much gentler, typically with fewer side effects than some medications. Research suggests it can reduce blood pressure by maybe 8 to 15 points. And often people report improvements in sleep quality and less anxiety too.
So multiple benefits.
Yes, we saw a case, a 78-year-old retired teacher. Her morning blood pressure went from 165/95 down to 142/82 in about 6 weeks. Plus, her chronic headaches disappeared and her sleep got dramatically better.
Wow, that's significant.
It really can be. The recommendation is usually 300-600 milligrams of extract taken before bedtime. The timing seems important, leveraging sleep's natural healing cycle. Then there's Shan Zha. You probably know it as hawthorn berry, the heart strengthener.
Right, hawthorn's quite well known.
It is, but VTM uses Shan Zha maybe more strategically, often in specific combinations and with precise timing. It works by gently strengthening the heart muscle itself while also relaxing blood vessels at the same time. Think of it like a subtle, natural workout for your whole cardiovascular system.
A workout for the heart, I like that.
Yeah, and there was a meta-analysis, looked at 14 studies, confirmed hawthorn consistently lowered both systolic and diastolic pressure. It also seemed to improve exercise tolerance and even reduce chest pain in older adults. You can use it as a tea, just steep about a tablespoon of dried berries, or take maybe 400 milligrams of a standardized extract. Fourth is Juhua, which is chrysanthemum flower. This is known as the cooling herb. This gentle flower is used in VTM to address what they call heat patterns that can contribute to hypertension.
Heat patterns. Interesting.
Yeah, it's about internal balance. It helps promote healthy circulation and offers a natural, very gentle diuretic effect, so it can help reduce blood volume slightly, but typically without depleting essential minerals like potassium, which can sometimes be an issue with pharmaceutical diuretics.
Gentler on the system.
Exactly. It's mild enough for daily use. We hear about people replacing their afternoon coffee with chrysanthemum tea and noticing their evening blood pressure readings are better. Preparation is simple. Just 6 to 8 dried flowers per cup of hot water, steep for 10 minutes. You can drink 2-3 cups daily. Pro tip: adding a small piece of fresh ginger can enhance its benefits.
Good tip.
And finally, number 5 is honghua, or safflower, the circulation activator. This is considered a blood-moving herb in VPM. It's particularly valuable for blood pressure issues that might be related to poor circulation, or what Western medicine calls endothelial dysfunction, basically, stiff, inflexible arteries.
Okay, so this one targets artery stiffness.
That's a key benefit, yes. It helps improve the flexibility and responsiveness of the blood vessel walls, maintaining that crucial arterial elasticity. Some studies show safflower extract can improve endothelial function by up to 25% in adults over 60. That often leads to more stable blood pressure readings over time.
Impressive.
It is. But, and this is really important, honghua comes with a significant safety note. If you are taking any blood-thinning medications, like warfarin, you need to be extremely cautious. You absolutely must consult your healthcare provider before even thinking about adding this specific herb. It's crucial.
Okay, that's a fantastic overview of these individual powerhouses. Dan Shen, Gou Teng, Shan Zha, Juhua, honghua. But you mentioned earlier that VTM principle, Junzhen Zuoshi, the idea that herbs work together synergistically. This raises an important question. Knowing the power of these individual herbs, how do we then combine them safely and effectively? How does Dr. Lisa take these ingredients and weave them into a practical, coherent protocol? Especially for listeners who might be on other medications already.
Right, that's the core of the Lisa protocol. It's not just about throwing herbs together. It's structured in phases very deliberately. This allows your body time to adjust and respond gradually. It's designed to maximize the benefits while really minimizing potential risks. So, week 1-2, the foundation phase. You start simple, just with Juhua chrysanthemum tea, 1 cup in the morning, 1 in the evening. This gentle herb helps your body begin that sort of detoxification, cooling process. The main instruction here is monitor your blood pressure daily. See how you feel. Early signs you might notice could be things like slightly improved sleep quality, maybe less morning stiffness, small things.
Okay, gentle start. Just tea.
Exactly. Then, week 3-4, adding the regulator. If you're tolerating the chrysanthemum tea well, no issues, then you add Gou Teng extract, usually about 300 milligrams before bedtime. Remember, this targets the stress response and helps with sleep regulation. You continue the Juhua tea as well. Now you're watching for, again, improved sleep, but also maybe more stable morning blood pressure readings. Many patients start seeing maybe 5 to 10 point improvements in their blood pressure during this phase.
Okay, layering it in. Precisely. Next, week 5-8, the heart strengthener. You keep the previous routine, the Juhua and the Gou Teng. Now you add Shan Zha, either 400 milligrams of extract with breakfast or 1 cup of hawthorn berry tea mid-morning. Choose one. This step aims to strengthen the heart muscle and relax those blood vessels. You might start noticing benefits like better exercise tolerance, maybe less shortness of breath during activity. This period, weeks 5 to 8, is often when people see their most significant blood pressure improvements. That's encouraging, so building momentum. Yes. Then, week 9-12, circulation enhancement. Continue all the previous herbs, Juhua, Gou Teng, Shan Zha, and now you add the Dan Shen extract. Typically 500 milligrams twice daily, taken with meals. This offers deeper cardiovascular support and aims to improve overall circulation more profoundly. By the end of this phase, your blood pressure should ideally be showing consistent improvement. And this is the point where, with your doctor's guidance, you might be able to start discussing potential medication adjustments. Very carefully, of course. Right, always with the doctor.
Always. Finally, there's the advanced protocol. This is really for month 4 and beyond. And it's only for those who have successfully navigated all the previous phases without issues. Here, you'd consider adding the Honghua extract, safflower. But very cautiously, maybe 200 milligrams every other day initially, not daily. This completes the full protocol, adding that focus on arterial elasticity. But again, extreme caution with blood thinners is needed here.
That's a very clear, almost like a roadmap, step by step.
Yeah.
But, as you've stressed, these are powerful tools. Safety absolutely cannot be an afterthought. This deep dive is all about empowering you, the listener, with knowledge. And that absolutely includes understanding the crucial safety aspects, how these herbs might interact with your unique body, and especially any other medications you might be taking.
Absolutely critical. When you're incorporating herbs, especially potent ones like these, and especially if you're already on medications, there are some non-negotiable safety guidelines. First, let's talk drug interactions you must know. We mentioned Honghua and blood thinners like warfarin. Avoid Honghua completely in that case. Dan Shen also needs caution with blood thinners. Only use it under strict medical supervision if you're on them.
Okay, crucial point on blood thinners.
Very ACE inhibitors. Generally compatible, but you still need to monitor closely for blood pressure dropping too low. If you're already on pharmaceutical diuretics, you'd likely want to reduce your chrysanthemum tea intake to avoid, overdoing the diuretic effect.
Makes sense.
And beta blockers. They might enhance the effects of Gou Teng, so if you're on beta blockers, it's wise to start with maybe half the recommended dose of Gou Teng and see how you respond. Next, you need to know the warning signs to stop immediately. These include your blood pressure dropping consistently below 90/60, that's too low, or feeling dizzy when you stand up, unusual fatigue or weakness that doesn't go away. Any signs of an allergic reaction, like a rash or difficulty breathing, stop immediately, or even digestive upset that persists for more than a few days. If any of these happen, stop the herbs and consult your doctor right away.
Okay, clear red flags.
Yes. Then there's the monitoring protocol. This is absolutely essential for using these herbs safely. Take your blood pressure daily, morning and evening ideally. Calculate your weekly averages to see the trend. And I'll say again, if your blood pressure improves significantly, always work with your doctor for any medication adjustments. Don't change meds on your own. Schedule regular check-ins, maybe monthly, with your healthcare provider, especially during the first 3 months.
Constant communication with the doctor is key.
It is. Now, quality and sourcing. This is, it can be life or death, honestly. Look for products that have third-party testing. This checks for things like heavy metals, pesticides, contaminants. Herbs can absorb these from the soil.
Right, you need clean herbs.
Definitely. Opt for standardized extracts whenever possible. This tells you the percentage of the key active compounds. For instance, Dan Shen standardized to at least 20% salvionolic acids. And always look for GMP certification, good manufacturing practice. It's a baseline quality standard. Avoid the obvious red flags. Herbs sold loose in unlabeled containers at markets, products making wild, unrealistic claims, or supplements that seem suspiciously cheap. Quality costs something.
Good points. You get what you pay for, often.
Often, yes. And finally, a couple of tips from traditional Vietnamese preparation methods that can actually multiply effectiveness. For the teas, like chrysanthemum or hawthorn, use filtered water heated to about 185 degrees Celsius, so not boiling. Boiling can destroy delicate compounds. Cover the cup while steeping. This keeps the valuable volatile oils from escaping. And drink the tea warm, not scalding hot, for better absorption.
Little details matter.
They do. For the standardized extracts in capsules, taking them with a small amount of healthy fat, like a few nuts or a spoonful of avocado, can help improve absorption of any fat-soluble compounds. Also, try not to take them with coffee or tea, as tannins in those can sometimes interfere with absorption. And if possible, space out taking the herbs from your medications by at least 2 hours. Just gives everything space to work. And the timing secret, it's really about consistency. Blood pressure lowering herbs seem to work best when taken at the same times each day. Morning herbs maybe 30 minutes before breakfast, evening herbs like Gou Teng before bedtime. Knowledge is most valuable when understood and applied, and here, mindful application really is the key to safety and success.
That level of detail is incredibly helpful. It really empowers you, the listener, to approach these ancient practices safely and effectively. But as you hinted, it's not just about taking the right herbs in the right way, is it? The most profound transformation, Dr. Lisa suggests, comes from integrating them with specific lifestyle practices. She talks about this Vietnamese 3 pillars approach, a complete path to reclaiming vitality, confidence, independence. This is where it gets really interesting, seeing 80-year-old patients genuinely start thriving again.
Indeed. It's a beautiful concept. Beyond the herbal pillar, there are 2 complementary pillars that really amplify the healing process. The first is Pillar 1, gentle movement that heals. Specifically, something akin to walking meditation. This is a common Vietnamese practice. It involves just 15 minutes or so of slow, mindful morning walking. The focus is entirely on your breath.
Slow walking, not intense exercise.
Exactly. Unlike aggressive exercise, which can sometimes even spike blood pressure temporarily, this gentle movement helps regulate it. It also helps circulate the herbs throughout your system, and importantly, it activates your parasympathetic nervous system. That's your body's natural rest and digest or calm down system. It naturally helps lower blood pressure.
Simple yet powerful.
Very much so. The second pillar is Pillar 2, the power of gratitude and emotional balance. Remember we talked about liver key stagnation? In VTM, we understand that unexpressed emotions, particularly things like chronic anger, frustration, worry, directly contribute to the stagnation. And that's seen as a major underlying cause of high blood pressure for many.
The emotional connection again.
Yeah, absolutely. So a simple but profound practice recommended is this. Each evening, maybe while you're sipping your chrysanthemum tea, spend just 5 minutes reflecting on 3 things you're genuinely grateful for from that day. It sounds simple, but this practice has been shown scientifically to reduce stress hormones like cortisol, and that directly supports healthy blood pressure regulation.
Gratitude is medicine.
In a very real sense, yes. And the real-world transformations when people integrate these pillars, they're truly inspiring. You mentioned Dr. Lisa's patients. Let me share one story, Mrs. Nguyen. She was 82 when she first came to the clinic. Her blood pressure was hitting 180/100 regularly. She was on 3 different medications and still struggling significantly with dizziness, fatigue. She felt her independence just slipping away.
That sounds tough.
It was. But she committed to the protocol, the herbs, the gentle walking, the gratitude practice today. Her blood pressure consistently reads around 135/78. And with her doctors, frankly, amazement and full approval, she's been able to reduce her medication down to just 1.
Wow, from 3 meds to 1.
Yes. But more importantly than the numbers, she regained her ability to walk to the local market again. She started tending her beloved garden. And in her own words, she said she felt like myself again. She didn't just get better numbers, she reclaimed her dignity, her energy, her joy. If we connect this to the bigger picture, true healing really is about balancing all these aspects of our well-being. It's moving beyond just managing numbers on a chart to rediscovering your inherent strength and vitality.
What an incredible story. That really hits home. It highlights that your health journey doesn't have to be this narrative of managing decline as you age. It truly can be about rediscovering vitality and possibility.
Yeah.
So what does this all mean for you listening right now? It means there's this profound potential when you integrate ancient Vietnamese herbal wisdom with modern safety protocols. You can manage and improve blood pressure, yes, but the benefits seem to be holistic, going far beyond just the numbers on the cuff.
Absolutely. So for you, the listener, thinking about this, here are some concrete next steps to consider. First, and this is paramount, always consult your doctor before starting any new herbal protocol. period.
Right.
Especially if you're currently taking any medications, we actually encourage you to bring this information, maybe the list of herbs, the protocol outline, to your doctor. Many physicians today are increasingly open to integrative approaches, especially when they see some scientific rationale and a clear safety plan.
Good advice. Be proactive with your doctor.
Exactly. Second, if you do decide to proceed with your doctor's okay, start slowly and be patient with yourself. Remember, these herbs are working to help rebalance systems that might have been out of balance for decades. Healing takes time. Give your body the time it needs to respond. And third, maybe consider connecting with others on a similar journey. Finding online forums or local groups focused on natural health or VTM, the power of community support in healing really cannot be underestimated.
Don't go it alone.
Right. And remember, healing isn't just about fixing what's broken. It's truly about rediscovering what's possible for you. Too many seniors, I think, accept declining health, fatigue, lack of vitality as just an inevitable part of aging. But countless individuals, like Mrs. Nguyen, have proven that narrative wrong. Your blood pressure numbers might be the initial focus, but they're often just the beginning. When you start supporting your body deeply with nature's wisdom, following these safe protocols, you often discover wonderful side benefits. Better sleep, more energy, sharper mental clarity, just an overall sense of vitality that you might have thought was gone for good. You really deserve to feel strong, confident, and healthy in your golden years. These ancient remedies, used wisely and safely, can potentially help you get there. So here's a final provocative thought for you to consider. If small, consistent choices, rooted in ancient wisdom like VTM and supported by modern science and safety checks, can redefine what aging gracefully means for something as fundamental as your blood pressure, what other aspects of your health, your energy, your well-being might also be quietly awaiting rediscovery?
A powerful question to end on. And just a reminder to everyone listening, always